Hello, and welcome to this pre-recorded webinar on essential tips for telebehavioral health engagement. My name is Daniela Labate-Cavelli, and I work for NIAPRS, and we're a MCTAC partner. I'm joined today by two of my colleagues, Eve Addis, also with NIAPRS, and Marlowe Passion from the Coalition for Behavioral Health. In light of the COVID-19 pandemic and the need for so many practitioners to work remotely, we thought it was important to put this webinar together. Now, the promising practices that we're going to discuss today are by no means an exhaustive list, and we recognize that many of you listening today are doing innovative things to engage the individuals you're working with. We also want to recognize and thank those of you that continue to do this work. Today's webinar is about what we're calling Tele-Behavioral Health, which is providing behavioral health services via technology. We hope that this webinar will help you to gain insight into how to engage and maintain engagement with individuals through planning, conducting, and summarizing and planning for future sessions. And just a reminder that the information and timelines are current as of the date of this presentation. Let's get started by talking about planning. The first part of planning for a telebehavioral health session is about communicating the why, and we don't want to take for granted what someone does or doesn't know here. And that includes asking what the person's understanding of social distancing is. We want to emphasize here that safety is the main reason that there may be a shift in how we're working together using telehealth, and that both the practitioner and the individual receiving the service are making this adjustment together. You may want to ask the individual you're working with what they're doing to stay safe, and ask if they have any questions about being and staying safe. And this will help lay the groundwork for your session, especially if providing services remotely is new to you. Now that we've communicated the why, let's move on to communicating the how. You want to be able to offer various meeting options to the individual you're working with, so it's important that you learn about various virtual communication options. We ask that you refer to state guidance on allowable virtual communication resources, and we've included links at the end of today's recording with information on state guidance, as well as the MCTAC COVID resource page, which includes tip sheets on using telehealth. Now let's get into the logistics of session planning a bit more. You have an appointment to meet with your individual, and so the next steps here are to explain expectations and logistics. And that includes who will initiate the session, how the session will take place, and how long it will last. Try to keep things simple and be mindful of the general anxiety that people have around technology, especially if it's new technology to them. You may offer to schedule a test run to help ease someone's anxiety. And to ease your own anxiety, it may be helpful for you to create a checklist of items that you want to cover during this initial session. Include things that will help orient the individual you're working with to this new type of session. It's important to find a space that's both private and quiet when delivering services via telehealth. Try to be mindful of the noise and possible distractions around you. You'll want to silence other phone lines and turn off email or other notifications. If you're meeting via video conferencing technology, be mindful of your background. Minimize distractions whenever possible and avoid windows or doors in the background. Think about how the person on the other end may respond to those distractions. It's also important to recognize what the challenges might be and to address those while making an agreement to meet virtually. Telehealth is a tool that practitioners can use to continue their therapeutic relationship. Of course, you'll want to discuss any concerns about privacy that the individual you're meeting with may have, and you also want to dress the part. You should dress as though you were meeting in person. Remember, it's important to be collaborative. Telehealth may be an adjustment for both the individual and the practitioner, and there may be bumps in the road, but you'll collaboratively find a way to make it work. Services via telehealth may be awkward at first, especially if you're used to having face-to-face sessions in an office or out in the community. It may take a few sessions before both parties feel comfortable, so be mindful of how the session is going. For example, telephone sessions may not last as long as video conference sessions because the individual you're working with just may not be as comfortable or used to talking on the phone for long periods of time. If you're using video conferencing technology, try to be mindful of the person's body language and what they're saying that way. It's important to tell the person you're working with that technology is a tool that both of you can use to stay connected, whether it's in this time of crisis or others. So before we get into talking about conducting the actual telehealth session, I think it's important to talk about the final piece of planning, which is getting through all of the glitches that can happen with technology. So it's not expected that the practitioner or the individual receiving the service is a tech whiz, but it is important that you, the practitioner, do what you can to help the session run smoothly. One thing you can do is to test your audio and or your video before starting. For example, make sure that you have adequate service coverage in the room that you'll be using, or connect to Wi-Fi so that a call doesn't drop. If you're using video conferencing technology, you'll want to test your video and audio to make sure that you can be seen and heard well. You might want to try testing this out with a friend or a coworker in advance just to help you work out any issues. You'll also want to develop a plan for what to do in case you're disconnected. So review that plan with the individual you're working with at the start of the session. Anticipate that there might be some hiccups along the way, but encourage the person you're working with that you'll work through those hiccups together. So now I'd like to turn it over to my colleague Marlowe Passion from the Coalition, and she's going to walk you through conducting the Tele-Behavioral Health session. Marlowe?
So conducting a virtual session can be a daunting experience on both ends, especially for those of us who may have limited experience and skills with virtual communication. But with planning, preparation, mindfulness, and lots of practice, this form of communication will become more like second nature, and we'll develop our own groove with it, much like many of us have adapted to new modes of communication and technology like emails, text messages, video chats, and social media. One key aspect for conducting a virtual session is to be intentional about why we're having this session virtually, what we want to accomplish together in the session, and how we're going to do it. Being intentional means using what we've developed from our session planning to guide us through the session and to structure the interaction. So from our session planning, we determine which virtual platform we would be using to conduct the session. If we're using a virtual platform, it's definitely helpful to get to the session early, maybe 15 minutes prior to the start of the meeting if this is your first time using the technology, to test out the audio or video and any web connections to make sure any last-minute hiccups to the technology can be addressed. Being punctual or even a few minutes early reflects and reinforces our intentions for the session and sets a good standard for the virtual interaction, much like how we would set a good expectation to be punctual for face-to-face in-person meetings. Part of being punctual is about maintaining focus and dedicating our attention to the present moment. This may sound counterintuitive, but one way to start maintaining focus is to check in first with ourselves to make sure we're grounded to the present moment. Take a quick minute to ask, what are we thinking about other than the session we're about to conduct? How are we feeling physically? What emotions are we experiencing? These are valid and valuable things that we may experience in tandem with the session that we're conducting, and as valid as they are, they may divide our focus if we're not mindful of them. So honor these thoughts and feelings and jot them down so they're not floating in our heads. Then put them aside for the time being so that our undivided attention can be focused on the session's agenda. Coming prepared with an agenda is key to maintaining focus and keeping the engagement process structured and inspired. 3 questions to ask in order to tune into the overarching purpose of the agenda might include, what is our intention for the session? What tangible result do we want to accomplish? What intentions do we imagine the other person has for our session together? Allow the answers to inform the agenda. Everyone may have their own style and structure, but some things on the agenda might include, at the beginning, conducting a check-in or a warm-up, maybe questions to fire up the conversation, stating a brief recap of the last session to maintain continuity, addressing any basics, any practical needs to prioritize, such as food or shelter, or any potential crisis situations to de-escalate. Think of the hierarchy of needs in terms of the person's current needs and motivations. In the middle of the session, tuning into the person's goals, revisiting why they matter, the values that may underlie the goals, and redeveloping how the person will continue to pursue aspects of those goals in the current climate. At the end of the session, summarizing the session, highlighting any outcomes, progress, or setbacks, as well as setting up plans moving forward and a rough agenda for the next session to maintain focus and continuity. During the session, it's helpful to keep the lag time in mind. Because we won't necessarily be able to tune into the full verbal and nonverbal communication that we would otherwise be tuned into in an in-person meeting, especially for phone calls where we won't see visual cues from the person, it's even more essential now to be able to sit with silence and allow some time for the other person to be thoughtful about their response. And although we may have an agenda of what we want to cover, it's helpful to allow time after each agenda item for processing and eliciting feedback about what's clear and what's been understood by the other person. For example, if we're providing instructions to the person, it's good to check in and ask them if they understand the instructions and have them paraphrase or repeat back what they think was communicated. Additionally, because the person won't be able to see visual cues from us, it's helpful to let them know in a phone conversation that what you're going to be doing. For instance, if you plan to take notes and there will be a period of silence on your end, let the person know that you're going to take a moment to jot down some notes at this moment. Very early in the session, it's important to validate. It's important to validate the session and the working relationship. Physical distance presents a barrier to communication, but it also presents an opportunity to expand on ways of communicating. Being conscious of the distance and limitations of telebehavioral health means acknowledging and being patient with any frustrations or heightened anxieties being experienced with adjusting to these changes in interaction. And what time it is to be able to relate, to empathize in a very powerful way with the other person, as we're all going through the same changes. Let the person know that it may take a few times for this form of communication to feel comfortable. Check in with the person about their comfort level with the medium and address concerns compassionately. This will elicit information that will be helpful in informing our intentions for future virtual sessions. What's working? What needs work? What's the person's preference? What technology have they had to adapt to in the past that they now feel comfortable with? And what did it take to become comfortable with that technology? One good tip is to practice concluding the session by affirming the triumphs of the process and the value of the medium toward maintaining your working relationship. Despite the distance, the connection was made and sustained, and the efforts to connect on both sides were worthwhile. This gives the person something positive to anticipate for the next virtual session. During the middle of the session, when together you're tuning into the person's goals, you're revisiting the why or the purpose of those goals and the values that are underlying those goals, we're redeveloping how the person will continue to pursue aspects of those goals now in the current climate. The first step is to ask the person what's important to them right now. Again, think of the hierarchy of needs. Based on their feedback, together you may need to establish new goals and work on something more pressing or available given the current climate. A good tip is to be mindful of what the person may be hearing or seeing in the media or from word of mouth, and to be prepared to address feelings that come to the surface as a result of this exposure to news. Things are changing daily at this time, and information is flowing at a rapid rate. People may be exposed to disturbing trends in the news or misnomers from questionable sources. It's important to temper a person's heightened anxiety with a balance of facts about current events and affirmations of the person's ability to weather this storm, their resilience, and their ability to focus on the actionable goals you set together for this time. Of course, at the end of your meeting, leave time to ask the person about their experience of the session. How did it feel? What was good? What was not so good? What suggestions do they have for how the session might be changed for the better? Did the time work for them? Were they comfortable with the choice of virtual and personal space? This process will elicit information that will be helpful in informing our intentions for future virtual sessions. Consider suggesting changes based on the person's answers, and don't forget to reflect on your own experience. Again, check in with yourself in a similar way as you've done at the beginning of the session. If the person expresses a negative experience, reiterate that it may take both of you a few sessions to get comfortable with virtual communication, and remind them that once there is no longer a public health and safety risk, You'll both be able to return to prior ways of connecting. At the end of the day, we're all in this together, and together, although physically distant, we'll make it better. And now, Eve Addis will be summarizing and planning for future sessions.
Okay, good morning or good afternoon, everyone, depending on when you're tuning in. So summarizing the session is important here because you want to make sure that you and the person you've been speaking with agree and have both understood the same things. So you want to give a brief summary of the salient points of your conversation, and you also want to start to indicate what the next session will be like, at what time. You want to plan here to make sure that the individual is clear about the next session. And at this point, it's a good idea to also include in that next session what the person's preferences may be so that the next session can be even more tailored to the individual's needs and preferences. Next slide. Now, this is a kind of practice that you may already be doing where you remind the person of the next meeting. Here, because of the conditions that a person may be experiencing, the distractions, the anxiety, it's really critical that you do send a text or an email reminding the person that what the next session, when the next session will take place, and as well as 24 hours prior to that next session, sending a reminder. This is good practice in general, but here I think under the current circumstances, it's probably really more critical. Next slide. So to summarize, this whole telebehavioral health approach to providing services is a tool. And it's a tool especially to kind of empower the person to self-manage, and also not only in terms of having the efficacy to use this medium, but also to encourage the individual to share with you what they're doing to stay healthy. So I know you may have an agenda, you may have some goals that you've been working on with the individual, but here you don't want to forget about what's happening in the current moment, and staying healthy is an important part of that. The second thing here is, and this my colleagues have stated repeatedly, is finding a quiet place without distractions so that you can be mindful and you can be intentional about this process. Again, be punctual, dress appropriately, have that agenda that helps to guide you through the session, and that allows both you and the person you're talking to this comfort in that you know where you're going, and that the person is following you, and also has the opportunity to speak and express what their experiences are. Remember, you and the individual in this session are partners, and you are partners both in what the agenda will be, but also in setting up and maintaining this new virtual service delivery option. Don't forget to discuss and explain expectations of what will happen, of how this will go, and how you expect to conduct your relationship with this individual through this crisis. It's not, I guess it's really so important here, and not to be underestimated, that you would and should elicit the individual's experience of this virtual way of communicating, particularly during the first two sessions, and then also, depending on the feedback, to adjust the parameters of this virtual way of delivering services. Next slide. Okay, now remember that throughout this whole process, there is the distance. you are doing this work and communicating with your clients in a kind of distance way, and there are implications of that. And remember that if you're doing a voice-only connection, it may be more difficult to conduct and maintain. And I think Marlowe had spoken earlier about people not really being comfortable with staying on the phone. So adjust your expectations based on the individual's comfort level with the medium you're using. Now, I can't emphasize more that the moment that we're all living under is the relevant moment. And you may have gone into this approach with reviewing goals that you and the individual have been working on, but there are new goals perhaps that the individual wants to address, those being the goals that are relevant to the moment. Again, make a plan to meet again, review it, offer the person the option to text message you in between the current session and the next session. Again, this will give them a sense of connectivity with you. And for some clients, this may be important to maintain the relationship through this virtual medium. Send that information about the next appointment via text or email, and don't forget to send that reminder 24 hours prior to the next appointment. We're using this technology to stay connected and maintain our relationship through this time of adversity. Find words that convey that so that you can make it clear to your clients that this is all about maintaining this relationship that you have with them. Next slide. And finally, please use the resources that are available, the OMAGE guidance page and the MCTAC COVID-19 resource page. These are the links. And I'm going to turn it back now to my colleague, Daniela.
All right, thank you, Eve. So in closing, I just want to encourage all of you to send in any questions that you may have on this subject to mctacinfo@nyu.edu. I'd also encourage you to check the mctacny.org webpage for future MCTAC and CTAC offerings. And I'd again like to thank all of you for continuing to provide the quality services that you do to those folks who need them in these unprecedented times. Thank you so much.